Hello, and thanks for joining us for a conversation on the HealthCheck program. I'm Bryn McBride of ABC for Health.
And I'm Kramolis, an MD MPH candidate, spending some of my time with ABC for Health.
And we're talking all about HealthCheck today. It's going to be an overview. We're not going to dig into a lot of the details, but this will be a good ground level set for people that might want to learn a little bit more about this Medicaid program feature and if it applies to them or their family. So we're going to start with just an overview. And Kelly, what do we mean when we say HealthCheck? It's a program? Is it a rule? Tell us a little bit about HealthCheck.
So HealthCheck is technically a federal law that requires state Medicaid programs to provide, and this is a mouthful, early and periodic screening, diagnosis, and treatment services for people under the age of 21 who are eligible for Medicaid.
So it's generally called kids, but this is kind of like a broad definition of kids, up to 21.
Yes, exactly. So young adults as well. So the point of this program, which is also called EPSDT, an acronym for all of those long words, is to prevent, diagnose, and treat health problems as early as possible. And it was created in the 60s, actually, to do this, and then had some amendments added to it later in time. But EPSDT in Wisconsin is called HealthCheck.
Not as much of a mouthful, a little bit easier to grasp.
Yes.
And it has that tinge of prevention in it, catch things early, so that children that are enrolled in Medicaid have this healthy start up through age 21. So it's a nice program. It's got a couple main components. Why don't we break them into three groups? What are the three main components?
Yeah, so the prevention component being that everyone who's eligible for HealthCheck, meaning people who are eligible for Medicaid, everyone eligible for Medicaid is eligible for HealthCheck, can have comprehensive screenings, or what some people call well child checks or well child exams. And they're entitled to 30 comprehensive screenings according to the American Academy of Pediatrics schedule from birth to age 21.
Sure.
So those are HealthCheck screens, and we'll run through in a little bit what a HealthCheck screen means. It's a comprehensive screen, which means it's a head-to-toe exam.
Sure.
And then also other services is part of HealthCheck. It's called HealthCheck Other Services. And these are treatments or products or services that are deemed medically necessary for the child or young adult, and we'll get a little bit more into this. And then there's also an outreach and case management component to HealthCheck, which is more just administrative case management, meaning making sure that people who are eligible for HealthCheck can access it and know it exists.
Because we know there are going to be some barriers, some bumps in the road, and we want to make sure that if you're eligible, you actually can get through to those services.
Yep, exactly.
You said we talk a little bit more about what it means to do these screenings. Why don't you walk us through some screening components?
Sure. So a lot of these screens are things that people are already receiving at their doctor as a well child check or a well child exam, like I said. But specifically, HealthCheck screens are supposed to include comprehensive health and developmental history, a comprehensive physical exam from head to toe, a vision screen, a hearing screen, and very importantly, and something that we see sometimes doesn't happen, an oral assessment and a referral to a primary care dentist.
Sure, that's big.
Big, especially in Wisconsin, we're not seeing that happening. Also immunizations, lab tests, and then general medical advice and counseling from the physician or whoever. A provider can be physician, nurse practitioner, a physician's assistant, anyone who's providing these screening services.
Sure. So the screen is quite comprehensive to include the vision, the dental, the hearing screens. And then there's some follow-up services that happen after you screen. You maybe identify some issues or need for more care. What happens next?
Later, after HealthCheck was created, they found that they were finding these problems, these medical problems on these screens, and then people weren't able to pay for the treatment for them. So that's what HealthCheck Other Services is. So if something is identified, a medical problem on one of these screenings, and a child needs treatment or follow-up services, then the provider can write an order or a prescription for that service. And if it's deemed medically necessary, it may be covered also by HealthCheck, even if it's not typically covered by Wisconsin Medicaid or whatever the state's Medicaid is.
Right. Yep. So that keeps somebody from saying, oh, we identified a vision problem. Good luck.
Sorry.
We're going to walk away. So now
exactly.
It's part of the process. If you do identify something, now see if it is deemed medically necessary, can we go through and then work on that treatment piece?
Yep. And we'll talk in a little bit about what medically necessary means.
Sure. So one of the follow-up components that's so important, up to age 21, is what you just said. This could be part of the state health plan. It could be a covered service. It could be outside of Medicaid, but because it's medically necessary, the state's going to pay for it. It's
Sure.
a covered service.
Yep.
So that's the distinction that's so important with HealthCheck
Yep.
other services.
Or it may be a service that the state says, usually Medicaid only pays for it up until this amount or for this diagnosis.
Sure.
And if you're outside of that, it's an option to have it covered by HealthCheck other services.
Right. It's a great feature. Like we said, one of the main 3 components of HealthCheck is this other service.
And
feature.
also the one that we find people know the least about.
And could be the most powerful.
Mm-hmm.
This could be where like the big service, durable medical equipment, a device could come in really handy.
Yep.
So let's talk through what I just rattled a couple of, like, why don't you tell us a couple others that you've seen more frequently?
Yeah, so the durable medical equipment, meaning wheelchairs or adaptive equipment for the home, is
Sure.
huge. As we know, these things are very, very expensive.
Mm-hmm.
So that's a big thing that's covered. Also, medical supplies, augmentative communication devices,
sure.
Certain dental services. Over-the-counter medications is a big thing, like vitamins or anti-diarrheals, antifungals. There's a whole list of them on Forward Health's website.
Sure.
And for an over-the-counter medication, you would still need to have a prescription from the doctor for it to be covered by HealthCheck, even though it's over-the-counter.
Right, so that piece is still important. That's a good detail.
Yeah. So there's a bunch of them listed here. If someone were to want to pause and take a look at them and see if they'd be covered. Again, these may be covered by HealthCheck other services. It's not a guarantee because it requires something called a prior authorization.
Yeah, walk us through that.
Sure. So a prior authorization, or a PA, as a lot of people say in the medical world, is a form used by Wisconsin Medicaid to determine if a service that is being requested is indeed medically necessary. So you'll hear your doctor talk about filling one of these out, and it's very important that your doctor, if you want something to be covered by HealthCheck other services, or if you really need a service you're not sure if Medicaid will pay for, that your doctor gives or your provider gives very clear advice on why this is absolutely medically necessary.
Right.
And he or she would do that on the prior authorization. So because most HealthCheck services require it to be medically necessary, almost all of them require a prior authorization to prove that it is medically necessary.
Sure. So it kind of serves that function of being almost like the prescription for the service that's needed, and vouching for the fact that it is for this child or young adult medically necessary. So it's covering that spread.
Yep.
And you're right, a lot of people just say, I think I need a PA for this. And that's what they're talking about, is this prior authorization request. I think we covered the spread on this, an overview of HealthCheck. Now, you've mentioned a couple of resources. We're going to put those in the description below so people can visit a webpage that we've helped to build on the HealthCheck program overall, a couple of resources, some guidance coming out the State Department of Health Services and the Medicaid Department, some resources out of Forward Health, some resources for providers, what they need to know. A lot of providers and pediatricians and other service providers should know a lot of this information. Some do, but like you said, HealthCheck other services might not be as well known as some of the other components. So,
and it's a complicated program.
Understandably, it's
a complicated law that really shouldn't be that complicated.
Right, but whenever you start a sentence with, well, it starts in federal law, I mean, then you lose a couple
exactly.
people. So the state has tried to help boil it down, but of course you can always send your questions to us, and we're going to put a link to our email address as well for families.
Yep.
Well, thanks for the overview, Callie.
Yeah, absolutely. And we'll be doing a secondary webinar specifically on the prior authorization process for HealthCheck if you're a provider who would like to learn more about that.
All right, thanks for joining us.
Thank you.